Welcome back. Well, today I am joined by Dr. Daniel Daring, who is here on behalf of MemorialCare. Well, Dr. Daring, thank you so much for joining us today.
Thank you, Lisa. Thank you for having me.
You're welcome. Now, we are talking about a situation where it's part of the vascular system called TCAR. But before we do that, I want you to tell me a little bit about yourself.
Yes, so I am primarily a vascular and endovascular surgeon here at Saddleback Memorial Medical Center. I'm part of a surgical group here, and I also practice general and trauma critical care surgery. I did my medical school training at University of Oklahoma and then went on to residency at Huntington Memorial Hospital. I did 2 fellowships at Cedars-Sinai for critical care trauma and also a vascular surgery fellowship in West Virginia University before I came back out to California to practice.
Okay.
And married with 2 lovely children and live here locally.
Okay. Awesome. And do you primarily focus on vascular situations now?
Yes, it's the grand majority of my practice. I do all types of vascular and endovascular surgery, which has anything to do with the blood vessels in the body, except for the heart and inside the brain. But we manage the cerebrovascular system, the extracranial vascular system.
Okay.
So yes.
So you said except the heart. Do you then mean just the arteries themselves?
Well, we do not manage the coronary arteries or do open heart surgery.
Okay.
That would be cardiologists and cardiothoracic surgeons who perform those procedures.
I see. Okay. Thank you for the clarification, because you'd think that based on what your descriptions are, that would be something that you would do, but that's a separate entity. So tell me exactly what is a vascular surgeon responsible for?
Well, again, we manage the medical and surgical care of blood vessels, arteries, and veins from the jaw down to the toes. And so we manage lymphatics, venous, arterial disease, carotid arteries. We provide dialysis access for patients with end-stage renal disease. We deal with aneurysms of all types. We manage venous disease, varicose veins, venous ulcers, and peripheral arterial disease where patients do not have adequate blood flow to the extremities. So quite a number of things, and we do quite a bit of medical management. We're surgeons, and we're capable of performing angiograms and inflating balloons inside blood vessels and placing stents, and also doing open bypass surgeries. But a grand majority of my patients are managed medically. So when you come see a vascular surgeon, you're not necessarily going to get surgery. So.
Okay. Well, good. I mean, that's a huge spectrum that you mentioned, and some of them I am aware of based on just family members, as well as, even people that I've talked to. It seems like I run into more people. I don't know if that's just because of my age, that are running into more issues with their vascular system, maybe because they don't have good circulation or whatever the case might be. But so tell me, with the extent of what we're talking about today, how does that compare to what we've just talked about? So we're going to talk about TCAR.
That's what we call it anyway. It stands for Trans-Carotid Artery Revascularization.
Thank you.
Yes.
Excellent. So what kind of a disease is this?
Well, carotid artery disease the carotid arteries are the two main blood vessels which supply about 90% of the blood flow to the brain and oxygenation of the brain. And over time, and with certain risk factors, high blood pressure, diabetes, high cholesterol, smoking, patients can build up atherosclerosis or plaque inside these arteries, which can then lead to strokes, which are the main symptoms. There is some restriction of blood flow, but the primary mechanism with which a stroke occurs is that this plaque grows over time and then becomes unstable to the point where small pieces can break loose and embolize to the brain. So we see it in asymptomatic patients. The grand majority is a silent disease, and the minority of patients present with symptoms where we can then treat. But the majority of patients who will have symptoms from carotid artery disease just simply present with a stroke as their first symptom.
Okay, so are there any symptoms that lead up to the stroke?
In the minority of cases, yes, there are symptoms. About 20% of patients will have a TIA, or a transient ischemic attack, which is a mini stroke. You can also have amaurosis fugax, which is evidence of the plaque breaking loose and going to the artery of the eye. And then the rest will just have a major stroke, which can be disabling or even cause death. Almost 800,000 patients in America per year suffer a stroke. About 1/3 it leads to death. Another third, it leads to major disability. So the symptoms, unfortunately, can be very disabling or even lethal. So the minority, about 20%, will have these mini strokes, which can be a warning sign. The rest are asymptomatic until they have a major stroke.
Okay, so in the 20%, would you say that some of the symptoms could be, I mean, are they similar to things that we would feel with other types of illnesses, or are they different?
So the symptoms are quite specific. A stroke symptom is going to be sudden blindness in one eye, sudden weakness or numbness on one side of the body. Sometimes there will be drooping of the face or slurred speech. Patients can also develop aphasia, which is the inability to speak or name objects that they would normally be able to name. And these are the warning signs of a stroke, which we would recommend patients proceed directly to the nearest emergency room or stroke center for immediate evaluation if such things should occur.
So what does TCAR, how does TCAR prevent stroke when you have this happen? Is that because, are you removing the plaque, or what exactly are you doing?
So TCAR prevents stroke. Ultimately, what TCAR is a placement of a stent, which is a metal tube, inside of the artery where the plaque is located.
I see.
And it essentially stabilizes the plaque so that embolization or breaking loose of small pieces of plaque does not occur. And so again, there are multiple ways to treat carotid artery disease. Medical management is the majority of patients who are asymptomatic. For symptomatic, we tend to be more aggressive and will proceed with procedures such as carotid endarterectomy, which is an open surgery to remove that plaque from the artery, and has historically been done as the standard of care, versus a stent. And that TCAR is a newer way, a safer way of placing a stent.
I see. I see. Oh, yeah, it's just amazing, the technology today. But then you also said you could treat it medically. So would that be some sort of a medication that you would provide?
So medical treatment for carotid artery disease is entails control of risk factors,
Mhm.
diabetes, hypertension, high cholesterol, smoking cessation, lifestyle modifications, healthy diet,
Mhm.
exercise. And then we also often add a baby aspirin, which is a mild blood thinner,
Mhm.
uh, to patients who have risk factors or a history of any type of atherosclerotic disease.
Mm,
We also have statin medications, which are very good at controlling cholesterol
right.
and stabilizing these plaque in the arteries. And we have other treatments such as Plavix, which is a stronger blood thinner, usually for patients who are symptomatic with their vascular disease. So it's something that we work with the primary care physicians and general practitioners to provide that medical care.
Mhm.
Again, in the grand majority of patients, but we're here for patients who may need a surgical intervention of some type.
Gotcha. Gotcha. Wow. It's just amazing. Like I said, all the different things that you can now do, but good to know that the majority of people, can be treated medically rather than having to go under the knife. So that's awesome. Well, thank you so much for the information. I appreciate it.
Yes, you're very welcome.
All right. We'll see you again.
Okay, see you soon.
Okay. Thank you.
Thank you.
And for more information about what we just discussed, you can go to memorialcare.org/SBTCAR. We'll be right back after this.